I seeing the right screen? All right, so welcome. My name is Dr. Kynetta Sugar McFarlane. I'm a clinical psychologist and the owner of Transformative Health, where I perform trauma-informed and affirming care to the community. And one of the communities that I get the pleasure of being able to work with is the Latinx, Latin, or Hispanic culture. So today we'll be talking about some facts about the culture. We will be going over some of the mental health needs of the culture, and then specifically going over ways that Ohio has looked at specifically supporting the mental health needs of Latin people in the Ohio communities. All right. Oops. Let's go back one. All right. So race is mostly defined and determined by looking at somebody's physical characteristics. So people will look at me and go, oh, she's African American because the texture of my hair, because of the shape of my features, because of the coloring of my skin, maybe even the shape of my body. Ethnicity refers to a person's culture, language, family, and place of origin. So, examples of ethnicity include being Indian, Jewish, Asian, or Hispanic, regardless of what race you belong to. So 19% of the US population, or 63.7 million Americans, are Hispanic. Now, why I say Hispanic right here specifically in this example is that often when you look at research that is done by the government particularly calls this group Hispanic. And this is where this information is coming from, the Census Bureau. So, in terms of our communities, people of Mexican origin make up almost 62% of the country's overall Hispanic population, followed by people of Puerto Rican descent. Research has found that 47% of Hispanics usually describe themselves by their family's country of origin, while 39% use the term Latino or Hispanic, and 14% most often describe themselves as American. Now, when asked, a survey in 2002 found that 53% of Hispanics prefer to describe themselves as Hispanic, 26% prefer Latino, and 2% prefer Latinx, and 18% have no preference. Now, most of the group identify as some other race or multiracial. The next largest group identify as white, and the smallest groups identify as indigenous, Black, and Asian. Now, there has been a growth in the community of Hispanic people who identify themselves as multiracial. And that has come from a big change in those who identify as white going to identifying as some other race. So that population went from 1.6 million to 23.7 million over the past decade. So there's been a big shift in the community of people who identify themselves as some type of multiracial. Now, most Latin adults say that their skin color shapes their daily life experience in some way. 62% report having a darker skin tone hurts their ability to get ahead, while having a lighter skin color helps other Latins actually get ahead. Afro-Latins report that their life is shaped by race and how dark their skin is. Research shows that most Afro-Latins identify as Hispanic or Latino. In 2020, about 6 million Afro-Latin adults lived in the US, making up about 2% of the US population, but 12% of the Latino population. And about 1 in 7 Afro Latinos do not identify as Hispanic. So Ohio's Latin population has grown by 140% since the 2000s. And you can see an increase in the populations in every county. Average age of the community is 25.8 years old. So in general, a younger community. And we have a little bit over 100,000 children in our public school system. A large proportion of Latino Ohioans live in urban areas, with 1 in 3 people living in Columbus, Cleveland, Lorain, or Toledo. And within our population, about half of them speak English as at home. Now, out of the 90% who were foreign born, about only 21% of that community speaks English at home. So those who were born in the country are more likely to speak English as a language within their home. So Hispanic and Latino, Latine, Latinx, Latin are terms that are used to describe a population of people who have an ethnic background of living within the US. So, as I said, the Census Bureau usually uses the term Hispanic, while the Pew Research Center uses the term Hispanic and Latino interchangeably when talking about the populations. Now, there have been like some distinctions that people have drawn, saying that Hispanics are people from Spain or from Spanish speaking countries in Latin America. And so if you look at the pink circle, so that includes Spain, plus all those countries down in the middle, they also speak Spanish. Now, this excludes Brazil, where Portuguese is their official language, while Latinos are people from Latin America, regardless of what language that they speak. So this includes Brazil, but then also all of those other countries that are a part of Latin America. And so you will see very differing definitions, because you will meet a lot of Haitians who will not describe themselves at all as Latinos, but based off of some definitions, they could be, in terms of understanding that Latino doesn't just indicate Spanish speaking, because they're also looking at cultural similarities. So the use of Latinx or Latin is not a common practice. And we've seen that term emerge because Spanish is a gendered language in terms of people are identified as generally like male or female. And so when we had a population of people identifying as non-binary, those two terms didn't really fit them. And so they were trying to figure out a way to like describe themselves. So Latinx, Latin, more are words that came from the queer community to be all encompassing of people who don't necessarily identify as like male or female. So when they actually like looked at like who had even like was aware of this term, 42% of adults age 18 to 29 said that they had heard of the term, compared to only 7% of adults that were 65 and older. Now, among the youngest Hispanics, women were the most likely to use this term in comparison to men. So, among younger Hispanics, about 14% were using the term Latinx or Latin versus only 1% of male identified people were using those terms. So, evidence shows that Latin youth have serious mental health needs and are not receiving the mental health care that they need. This was highlighted during the COVID-19 pandemic, which shows the disparities that these youth in these communities had and how these disparities actually increased and more visual during COVID. Now, some of the specific experiences that Latino youth may experience are discrimination, exposure to traumatic events, and migration experiences. Nearly 22% of Hispanic and Latino Americans report having a mental illness compared to 23.9% of non Hispanic whites. Only 36% of Latin Americans report receiving mental health services compared to 52% of their white peers. When we look at substance use disorder among the last year, it was 15% usage in terms of illegal drug use, around 20%, and unmet mental health treatment needs were about a quarter. It is important to note that suicide is the third leading cause of death among Latin Americans ages 10 to 24 years old, and specifically also in men ages 25 to 34 years old. In 2019, 40% of Latin high schoolers said that they felt sad or helpless most days during the last 2 weeks. The poverty rate of Hispanic and Latin Americans is nearly 2 times higher than their white peers. 23% of Latino Ohioans are living below the poverty line. And almost 20% of Latin Americans were not covered by health insurance in 2021, compared to about 6% of their white peers. So when we talk about Latin Americans' experiences with mental health care services, we can see a number of barriers. So one of them overall is experiences of racism and discrimination. And some of these are from like structural and systemic factors. So some is from things like poverty, making overall access to treatment for people in low resource areas more difficult. And one of the primary things that also makes access to treatment difficult is having to rely on public transportation. And so that. But then other experiences of racism and discrimination have to do with issues about not recognizing the traumas that they have gone through. Often people don't recognize how racism and discrimination are also a part of people's trauma experiences. So when going through and doing those types of assessments, not asking people specifically about these experiences, and therefore we do not address that when we're thinking about their healthcare needs. Another thing in terms of culturally is stigma. They're not necessarily used to this system. The system is very like confusing and cumbersome. Going to mental health care may not be a culturally normative practice. And they have a history of those who have gone into practices being discriminated against and not getting the same quality care as their peers. Another thing is language access issues. And so, in terms of actual care, when we look at Ohio, we know that, like, overall across the country, we see overall a provider shortage in terms of mental health care services. But we specifically see a provider shortage in us who are of diverse racial and ethnic backgrounds. Research shows that only 2% of Ohioan therapists are Spanish speaking. That puts language access at a greater level of difficulty when we talked about, like, the number of people where Spanish is the primary language that is spoken within
Okay.
the home. So that is likely
You
the
just missed
language
her.
that
Oh, sorry about
somebody
that.
needs to be
Yep.
muted. It's okay. And so that is likely also to affect their experiences being able to come into treatment,
No.
whether or not they're able to find an agency that is able to provide um, Spanish speaking services. As a trauma services provider, I had difficulty in terms of, while I was in a system that was using translators who had been specially trained in mental health treatment, having a person come to a trauma session where we may be talking about sexual abuse, where we may be talking about somebody's trauma narrative. I've had the experience of having to give, like, services and had to stop treatment sessions because the translator was not able to cope with what we were actually talking about within the session. So that just discusses, like, some of, like, the difficulties, not just in language access, but also with providers. Overall, as providers, we're less likely to diagnose mood disorders within this community and more likely to prescribe medications versus offering treatment. Also, us being lack of culturally competent in terms of being able to recognize resources, being able to recognize, like, stressors that are associated with the community, being able to recognize community ways of coping, all affects the type and the quality of care that our clients would be able to receive. But we are doing some things throughout Ohio to try to deal with these challenges. So the first thing is the promotores de salud, also known as community health workers. And promotores work in community outreach and in improving public health. These are peer educators who live in the same neighborhoods where they work and share similar socioeconomic, racial and cultural, language, and life experiences with their community. This increases their community's trust because these are actually members of their communities. And part of what these individuals do is help support under-resourced and underserved communities. So in Latin communities, the promotores are becoming really critical in prevention, permitting health education, and also helping people to access healthcare services. So one of the things that Ohio has done is they specifically train some promotores in um, the early signs of autism and other developmental disabilities. These workers receive specialized training to help their communities with outreach, education, knowledge about developmental milestones, knowledge about autism, developmental disability, also about how parents can advocate for themselves and how to get through the really confusing mental health care system. Another program is mental health navigators. Now, mental health navigators engage in outreach, screening, referrals, and behavioral health education. Now, these navigators are behavioral health workers already, versus the promotores are like lay peer support members of our community. And so these are behavioral health members that link patients with healthcare systems. And these navigators have specialized training to help them be able to provide information, education, and like smaller intervention services. And they're very helpful because overall, we know that under-resourced communities can be very overwhelmed and intimidated by the mental health care system. So, two sites within Ohio. First, at Our Lady of Guadalupe Center in Columbus, and Sukasa in Cincinnati, identified staff members to be trained as mental health navigators. These navigators have identified referral opportunities for community members. They provided mental health outreach, education, they did screenings, they provided support, and they provided brief interventions for community members. Both programs were successful in connecting community members with getting their needs met. And also, it helped to be able to identify within agencies the needs for more education and more resources to really adequately support these members of our communities. So I want to thank everybody for their time today, and I'm open to any questions.